The mediastinum, it is the area of the thorax that lies between the two pleural cavities. Anatomy of the mediastinum. The boundaries: anteriorly sternum, posteriorly vertebral column, superiorly thoracic ulnet, inferiorly diaphragm, on each side mediastinal pleura. The divisions: the mediastinum is divided into the following parts: superior mediastinum, which is separated from the inferior by an imaginary plane passed from the sternal angle anteriorly to the lower border of the body of the fifth thoracic vertebra posteriorly. The inferior mediastinum is subdivided into three parts: anterior mediastinum, which is in front of the pericardium, and the middle mediastinum, which is the pericardium and its contents, and the posterior mediastinum, which is behind the pericardium. So the division of mediastinum is divided, as we said, into superior and inferior. And the inferior mediastinum is subdivided in three parts. First part is the anterior mediastinum, second part is middle mediastinum, and the third part is posterior mediastinum. Now we will speak about the contents. Superior mediastinum contains tubes, vessels, and nerves. First, the tubes. Tubes are esophagus, which is the most posterior structure. Second is the trachea, which lies in front of esophagus, and third is the thoracic end, and is the thoracic duct. The vessels include arch of the aorta and its branches, which is brachiocephalic, left common carotid, and left subclavian. And the second vessel, which is superior vena cava and its two brachiocephalic or innominate veins. Nerves. The nerves of superior or nerves present in superior mediastinum include right and left phrenic nerve and two vagi and the left recurrent laryngeal nerve. Contents of the anterior mediastinum include the thymus gland. Contents of the middle mediastinum include heart and the pericardium, then arteries, which are ascending aorta and pulmonary artery, and the veins, which are lower half of the superior vena cava and part of azygos vein and inferior vena cava. The nerves, which is the phrenic nerve, the tubes, which include lower part of the trachea and its bifurcation. Posterior mediastinum contents include the following: the descending aorta, and the azygos and the hemiazygos veins, and two vagi and splanchnic nerves, and the esophagus and the thoracic duct. And all components of mediastinum contain lymph node, connective tissue, and lymphatics. Disease of the affected or disease that affect the mediastinum include mediastinitis, fibrosis, pneumomediastinum, and mediastinal masses, which may be benign or malignant. Cause of mediastinal masses: mediastinal mass of the anterior mediastinum include thymoma, thyroid swelling, terrible lymphoma, and teratoma. And masses in the middle mediastinum include aortic aneurysm, pericardial effusion, bronchogenic carcinoma, and cardiomegaly. And the masses in the posterior mediastinum include neural tumor, such as neurofibroma, neuroblastoma, paraganglioma, and esophageal tumors, descending aortic aneurysm, and the posterior diaphragmatic hernia. The superior mediastinum masses include aortic aneurysm, retrosternal goiter, thymoma, esophageal tumor. Clinical picture of mediastinal masses. Mediastinal mass can be asymptomatic in 30 to 50% of cases, and sometimes there are pressure manifestations due to compression on the following structures. If there is compression on trachea, the patient can come with dyspnea or breathy cough. And if there is compression on esophagus, so there will be symptom of dysphagia. And if there is compression on thoracic duct, so chylous effusion may be present. Pressure manifestations of the vessels. Superior vena cava, if there is compression on superior vena cava, the manifestation will be congested non-pulsating neck, congested non-pulsating neck veins, collaterals on the chest wall, and edema of the face. And if there is compression on the adiagos vein, the engorged veins on the upper part of the chest will be present, and compression on the aorta will lead to ischemic pain and equal pulse of the upper limbs. Pressure manifestation of the nerves. Left recurrent laryngeal nerve compression will lead to hoarseness of the voice. Compression on the sympathetic chain will cause Horner syndrome. Compression of the phrenic nerve will cause hiccup, diaphragmatic, and diaphragmatic paralysis. And the compression on the bones, such as ribs, will lead to rib erosion with pain, and on vertebra will cause vertebral pain, and on the sternum will cause sternal pain. The clinical manifestations of the cause. Thymoma will lead to myasthenia gravis, red cell aplasia, and myocarditis. Pneumomediastinum, it is the presence of air in the mediastinum, and the etiology is alveolar rupture with dissection of air into the mediastinum and perforation or rupture of the esophagus or trachea or main bronchi. And the clinical picture of the pneumodiastinum will be typically there is severe substernal chest pain due to stretching of the mediastinal structure, and the physical examination usually reveals subcutaneous emphysema in the suprasternal notch and the Hammond sign, which is a crunching or clicking noise with the heartbeat and best heard in the left lateral position. The diagnosis is confirmed with the chest x-ray. The treatment of pneumodiastinum, usually there is no treatment required, but if mediastinal structures are compressed, the compression can be relieved with needle aspiration. Acute mediastinitis, it is a life-threatening condition. The etiology is esophageal perforation as a complication of esophagoscopy or insertion of a Blackmore tube and the cardiac surgery. Clinical picture, dramatic chest pain, dyspnea with fever due to mediastinal infection, and treatment include antibiotics and surgical drainage. What are investigations of a case with mediastinal mass? Investigations of mediastinal mass include chest X-ray, CT, and MRI, contrast studies in certain situations, and include barium swallow, angiography, bronchoscopy and biopsy if needed, and scalene node biopsy, and radioactive iodine uptake of the thyroid swelling. Treatment of mediastinal mass. All mediastinal masses, whether benign or malignant, must be surgically removed because they may enlarge and compress mediastinal structures and may cause bleeding or rupture or infection or may cause malignant degeneration, and include mediastinal mass include treatment of the cause. That's all. Thank you.